Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to run over something I think that everybody that works on anybody's teeth ought to do on every patient you see. You should examine the temporal mandibular joints, about two of them, on every patient you see. Just a simple joint examination and write down the results that you get in there. So I'm going to try to draw some of this out for you. But the first place, let me go to a screen here that we can see. And I'll go to this white screen. And now I can draw in here. When you first see the patient, in other words, when they first come in, just examine their mouth. See how wide the person can open their mouth, like that. And then measure it. If you've got a closed bite, you measure the amount that's closed and the gap in here, and then write it down how much you can get your mouth open. I had a little patient once that could open only 28 millimeters, and she had a joint problem before I started. She couldn't open her mouth because the discs were out in front of the condyles. Let's say this is the fossa, and it comes out like that, and the person had a condyle fits in here, and you've got your disc over it, and as you open your mouth, the disc follows it, and it's attached up here, and it also has an attachment at the back of the head of the condyle. Now, when this little girl opened her mouth, this disc had been pushed out in front of her mouth, and it was lined up in something like this in the front of the mouth, and she would get down here about 28 millimeters, and that was as far as she could open. And luckily I wrote this down, that she couldn't open her mouth that far. Now, the mouth didn't click or anything, but she can get just a little bit like that. But after I got to working with her and got her relaxed and everything, after an appointment or two, then the condyle would get up on top of the disc. In other words, you'd have the condyle would move up to something like out here, and then the disc would pop up on over it, and that would make this little clicking sound. And now the mother came back, and she was real irritated with me. Said I brought my child in here, and she didn't have any joint problem, and now she's clicking. Well, the click was better than actually no click. So if a person can't open their mouth properly, you know something is interfering with it opening, and if the disc gets in front, this ligament that holds it in here stops the jaw from opening wide. But if you keep opening and you get relaxed, then it'll pop back up on there. And if you get an early pop, sometimes you can get this to heal up and everything, and it'll function normally. Now let's kind of erase that to start with. Let me go back to the white screen again, and let's just get this down good. Now the condyle is going to be something in here, and this disc will be sitting here, a double concave disc, and this center part is the part that doesn't get fed unless you're getting synovial fluid from around the edge. This has a blood supply, and then you have this retrodiscal tissue back in the back that also, when you close, it squeezes fluid, which goes in, and you have a upper joint space and a lower joint space. Both of them get the synovial fluid, which feeds the joint there. So let's go on. So we got somebody that you can open their mouth, say 50 millimeters or something like that, and you write it down. And if you have teeth that are kind of fitting out here, like, and you've got a deep bite case, say if somebody closes it up there, you measure this part and now have them open however this edge goes up and this goes down, and you measure, and the distance in there plus this much here, and that's how far they can open their mouth. And that ought to be written down. Now it's simple to feel the jaw joints. If anybody, I mean your own, just if you're out here looking at this video, feel your own joint. I'd like for you to contact us or drop us a note or something if you have a TMJ problem right here. Now there's a lot more people have slight problems that just don't get a lot of force. But if you put your fingers right in front of the ears like this and open your mouth, you can feel the condyle underneath your fingers. And then you get any spot like this, you can roll around and you can feel the edge of the condyle right here, this part right here. Now, don't think about the disc in a single deal. It's a round, probably the head of the condyles, or these discs up here, they are kind of an oblong kind of shape like that. And the reason the disc is shaped like that, and the fossa is a loose area, because people chew from their left or to the right. The condyle, when I go to the left to chew, these teeth touch, but these don't touch. The condyle comes up on the fossa, the head of the fossa right there on one side, and disconnects these teeth. They don't hit. So you can chew right here, or you can chew on the right side, then the condyle over there will be touching on the side that you're chewing on. And if you bite your teeth forward, in other words, you move these front teeth out like this. Let's just get another deal up here and show that. Like if you move your front teeth out here to bite something, that's not too good of a tooth, and you're going to bite something in here. Now you've moved this from something like this, and you'll have we have an overjet is that much, and an overbite is this much right here. And when you bring it to that point, in other words, the head of the condyle back here is in a different position on the joint. If you just bring your condyle out and you're touching here, you're touching your front teeth together, and that's all that hits, is this, and the teeth are touching here. And this is why you can't bite hard with your front teeth, because the muscles are in this area right here. They're pulling it back, and you've got a long distance out here. If you bite with 10 pounds out here, then you've got about 20 or 30 pounds on the heads of the condyle that's shared between the tonsils. That helps out a little bit. But you don't bite hard there. You go back in here and bite between you. The muscles are coming down over the wisdom teeth and the second molar if you put your finger in here. And that's where you do your hard biting. Well, back to the examination, you just feel up here and have them wiggle their jaw from side to side, and take your finger and go all the way around the condyle. I mean, all just go all the way around. You're feeling the outer part of the condyle. If that condyle is sore, in other words, somebody's gotten hit in the jaw and they've damaged it and it's hurting and they come into you hurting, you can find out just how bad it is. If it's really sore and it swells up, this tissue will swell up in the joint here. Let's get us another page here and write on that. Now, if you get a blow in the joint, in other words, your fossa, something like this, and you drives the condyle back in this direction, this retrodiscal tissue is here, and the brain is just right close in your ear, is in here. And this tissue can get inflamed. It'll get swell up, in other words, and it swells up and gets bigger. And now when you chew, your condyle is constantly aggravating this swollen joint. You can take anti-inflammatory things, but if you don't have enough, you get them to shrink enough where they don't touch and hit, and then that soreness stays with them. So this is, you get somebody with a sore joint, and you press on this, and I've had mine hurt, and I didn't even want to touch it or get close, and they won't want you to. So we take a transcranial x-ray of these. That kind of shows you a little bit, but it doesn't tell you how to do this. Now, so you get relief from a sore joint here by moving the teeth further forward. So that the condyle, instead of touching up here, will come up to something like that, and it won't put any pressure on the joint when you chew. But you have to have a bite plate or something in your mouth that separates your teeth back in here, and if these teeth are separated properly in here, you've got a gap and you can't close them, then the condyle won't be pushed up against that. But the load is going up and down the teeth rather than up and down on the condyle. So that this may get a little confusion, but if you examine that person and they've got two sore joints or one sore one, and they open their mouth, if they have one side that the disc is off, the jaw will go to one side. It'll hang over here. And then if you open it and pull it far enough, and if it's an early click, it'll click, and now the jaw going back to the center, and you can open it as far as you can want to. If somebody's disc is off on two areas, you'll open it and it'll kind of go this way and it'll click, and then it'll click again on the other side. You can feel these clicks when you're talking to somebody, or just putting your finger up here. If it's sore, they won't let you put your finger in there. Now, if somebody aggravates this joint and gets it hurting, and now, regardless of what they do, they have to chew and they have to talk and everything, and so the condyle keeps aggravating this swollen joint, and the joint just seems to go bananas. And I don't know, if people come in with headaches and their neck aches, their shoulders, their chest, they can have pain all around over the body, and it'll be originating here. The rest of the body kind of shares this with them. So I've had patients that have had temporal mandibular joint pain for years, and they've been to lots of, this was back several years ago. The doctors now seem to know more about it, and they'll suspect that that's what it is. But back then, they didn't pay attention to the joint. They just trying to figure out why the shoulders hurt and why these other parts of the body were hurting like this. and all it would be a temporal mandibular joint. So if you got a patient and you go to touch up here, and they're having headaches, you can bet your dollar it's probably not anything but the problem with the joint. Or if they do have headaches from other causes, you get the pain away from the joint and heal it up. So you do that by forward repositioning the jaw, and you make a split, and it goes out, and you put a ramp back here that brings it out, and the person can't take their teeth out here. They have to close here and have to wear this day and night. So you do that. So write down how far a person can open. If they hang and it goes one side and they open, they can open. Or if it hangs and it clicks again over here, write that down. Just so that you know how much they open and everything. And then if it's sore, at what point right here, you can, well, I open it halfway and I get a sore spot right in here. Then there's some reason. If you advance the mandible on most of these people, the condyle here will move out. It'll be out in here, or else it'll be in here and just stay out here when they're wearing this splint. And that leaves this alone to let it heal up back here. Now, this, I know it's hard for me to explain this over the video. It's hard to do this, but if you look people in the eye and then show them and have them open and close, a lot of people will just have them relax and just close your teeth where they won't. Just relax and let your jaw kind of open and close with your head in a normal position right here. Your teeth will normally, your jaw will go where it wants to go. And so that's where we make the splints, where the jaw wants to go. And if this heals up, sometimes you can go back further with the teeth and the condyle, and you get this, the swelling goes away in here, then this can go back pretty much where it was. Or it may be something on the teeth that won't let it go back. So I'm just saying that everybody that does anything with anybody's teeth, write down what it's like, because they will come back, and if they have a problem and it just doesn't reveal itself when you start, and then it does after you work on them, they tend to blame it on what you've done to them. So you need to write all this down when you start like that. So I appreciate your watching, and this is something that I think everybody, don't care what kind of dental work or anything else you do, ought to examine everybody, because you sure don't want to put a crown on somebody where they have a disc that's off. If the disc gets back on, that separates the teeth, and your crown doesn't fit down like it should. So these are things that happen to us, and I want you to understand this, so when you deal with people, really nurses and physicians, and if you do any kind of dental work, you can create a TMJ problem. So thank you for watching, and I want to hang up here today, and maybe this will do this. I think everybody ought to know how to examine the joint to feel how bad it is. You can take your finger, gloves and everything, go in there and feel the muscles up in there, but really just putting it right on top of the condyle, you can tell almost anybody with a jaw joint problem. So I'll say goodbye and so long, and I hope that this helps people wherever you are working on somebody's teeth to examine this joint and just jot down how much they can open Does it go to the side and come back? You can draw a little line down here and how many millimeters it does and all that. And you have a click here and click over here and different things. So thank you for watching, and I'm going to sign out now and say goodbye.